Hi, my name's Baz and I'm a mental health pharmacist. In the last video, we spoke about mental health medication and the myths surrounding that. And then, that's not even a word.
Stop it.
Oh God, okay, fuck it. Okay. Hi, my name's Baz and I'm a mental health pharmacist. In the last video, we spoke about mental health medication and myths. Today, I'm going to speak to you about sleep and its importance on our mental health. So a lot of people will know that sleep is important for our daily function, but it's also important for us to have good mental health and well-being. Sleep's really important for us. So when your sleeping habits slip, then your mental health is likely to slip as well. And there's a lot of evidence to show that poor sleep or a lack of sleep can lead to or worsen mental health conditions like depression and anxiety. So what happens when we sleep? We know that sleep is important for dreaming and we know there's different stages of sleep, but sleep actually affects every cell in our body. So there's evidence to show that poor sleep can actually lead to an increased risk of infections, obesity and heart disease as well. Sleep is also really important for memory, learning and thinking. And also when we sleep, your body releases hormones that lower your blood pressure, lower your heart rate. So it's also important that we get enough sleep so that we're not anxious as well. In terms of your mood, during your sleep, your brain is actually going through your memories and your thoughts. And it's really important for you to have good deep sleep so that you can consolidate positive memories and thoughts. So that's why sometimes the phrase of, you woke up on the wrong side of the bed, that's sort of where that comes from. So it's really important that we do get a good night's sleep. And there's many different ways that you can do this. I know a lot of people probably know about, having a good routine, trying to go to bed at the same time and waking up at the same time, trying to make sure that your sleeping environment is relaxed, trying to make sure that you wind down before you sleep. So, not staying on your phone, not watching a Netflix program, trying different ways to relax. And there's also things that you can take as well. And it's important to be careful when you want to take something to help your sleep that you've tried other things beforehand as well. But in terms of buying things, you can go to your local pharmacy and buy sleeping tablets, and they will ask you some questions just to make sure that it's suitable for you. There's also some herbal things that you can try. So there's something called valerian root, also known as Calms, which you can buy over the counter. But it's important to make sure that you let the pharmacist know if you're on any other medication because it can interact with some things. You can also try chamomile tea, and that's a herb that's been used for centuries for, insomnia, muscle relaxation and things like that. And all of these are really important for good sleep. If you're really struggling after trying different things with your sleep, you can go to your GP and you can ask whether there are any other options for you. There are some medications that can be prescribed, like benzodiazepines, example could be diazepam or something called zopiclone. But it's really important to know that these medications are highly addictive. And they should only be used sort of in extreme circumstances where lots of other things have been tried. Because if you use them for too long, you run the risk of getting addicted, and that's really dangerous on the body. And actually, in the long term, it can actually make your sleep even worse. So there's lots of different things that you can try to improve your sleep. But it is really important that you make sure that you're getting a good night's sleep. Avoid caffeine before you go to bed, and even alcohol. Even though alcohol can be sedative, it actually doesn't allow you to have a really good deep sleep. And it's that deep sleep that you need to make you feel good in the morning. In the next video, I will be talking about what it means to be sectioned and getting admitted into a mental health hospital or facility.